Okay. All right. Have you ever gotten a full night's rest, but when you awoke, you were still tired? Any dryness of the mouth or headaches after waking up? Have you ever been told by your partner that you stopped breathing in the middle of the night? Or have you ever had to kick your partner to the floor over loud snoring? All of these could be signs of a sleeping disorder recognized as sleep apnea. It can be found in anyone no matter what your gender, race, or age may be, but it's more commonly found in African American and Hispanic men that are over the age of 40 and overweight. According to the National Sleep Foundation, it affects more than 18 million Americans. So what is sleep apnea? Sleep apnea is a common disorder in which you have one or more pauses in breathing or shallow breaths while you sleep. Some people even stop breathing while they're asleep, but they never know it unless their partner tells them so. A lot of the times, people who have the disorder often aren't diagnosed because no one ever tells them or they ignore the signs. This disorder, like many others, can affect children. So today we're going to discuss the symptoms, diagnosis, and treatment of sleep apnea. First, let's start by discussing some of the symptoms of sleep apnea. One of the most common symptoms is loud snoring. Not all loud snoring means that you have sleep apnea, but if your partner isn't getting to sleep or you wake yourself up with a loud gasping sound, sort of like a pig, then maybe you want to consult with your doctor about a few things. As much as 100 times a night, a person with sleep apnea can have pauses in their breathings anywhere between 10 to 20 seconds. Other signs and symptoms include memory or learning problems and not being able to concentrate, feeling irritable, depressed, or having mood swings or personality changes, waking up frequently to urinate, dry mouth or sore throat when you wake up, and children's sleep apnea can cause your kids to be overly hyper and failing in school and bad behavior. Next, if you or anybody you know happens to suffer from some of the symptoms we went over, it's very important that you get yourself or that person you know to a sleep specialist. A sleep study is done so in a sleep lab, overnight, and in some cases at home using special equipment. During sleep, a polysomnographic technologist watches over you while you're asleep. They use an EEG that measures your brain waves, and EOG that measures your eyes and chin movement, and an EKG that measures your heart rate and rhythm. Chest bands that measure respiration, and additional monitors that sense oxygen and carbon dioxide levels in the blood and record leg movement. If you are diagnosed with sleep apnea, the next step would be to treat it. Positive airway pressure machines are the main machines used with different breathing masks to treat sleep apnea. The mask is worn over the nose and mouth while the person is asleep to keep the airflow continuously going down the person's throat. Oral appliances are used in patients who are diagnosed with mild to moderate obstructive sleep apnea. The oral appliance is worn like a sports mouthpiece while the person is asleep. There are over-the-counter appliances that you can use, but they are not recommended because it can worsen the severity of your disorder. With that being said, it's best to seek professional care in order to get the right fitted mask and oral appliances. The other treatment methods you can use are the Thornton Adjustable Positioner, better known as a TAP, the MyTap PAP Nasal Pillow Mask, the Normal, the Somnodent Fusion, the Oral Nasal Airway System, better known as OASIS, the Tongue Retaining Device, TRD, and the Upper Airway Stimulation Therapy. All right. Today we discuss the signs and symptoms of sleep apnea, how you're diagnosed with sleep apnea, and treatment methods used to get a good night's rest. If you or someone you sleep in close contact with has this disorder, take care of them. Take care of yourselves and get them to a specialist so this disorder doesn't keep you up all night. So what I want to leave you guys with is a positive quote of mine. You ready for it? All right. A person that falls asleep in the bed snoring deserves to wake up on the floor. All right. And that was my speech. So you can stop.